This is what will actually happen to your body when you do 50 squats every day. As fitness culture grows exponentially, many people believe they need sophisticated equipment, extremely expensive personal trainers, and cutting-edge supplementation to achieve results. It's natural that the industry encourages this idea. After all, they profit enormously from it. But the truth? It's far from all that. If you train for health and not to compete professionally, in the vast majority of cases, less is more. And in this context, the squat is simply the best investment you can make for your body. It's no wonder that it's considered the king of exercises. That's why today you'll see 8 surprising benefits that your body experiences when you include just 50 squats in your daily routine. Before we begin, please leave in the comments your name and the city from where you're watching our content. Benefit number 8. Greater hormonal balance and stimulation of testosterone production. Squats, being a compound exercise that involves large muscle groups, stimulate the release of crucial anabolic hormones, especially testosterone and growth hormone, known as GH. Think about it. Each time you go down and up in a squat, you're sending a powerful signal to your endocrine system. The muscle fibers of the legs, glutes, and core are subjected to positive stress that, in response, makes your body release more testosterone. This hormone is fundamental not just for men, but also for women, in appropriate amounts for each gender. The increase in testosterone translates directly into greater protein synthesis, which means stronger and more defined muscles. Additionally, testosterone optimizes body fat burning, encouraging your organism to use fat reserves as an energy source. This explains why people who include squats in their routine frequently report visible changes in body composition, even without significant changes in diet. The absence of this hormonal stimulus, on the other hand, can lead to a gradual decline in testosterone levels, especially after age 30. Men with low testosterone frequently experience chronic fatigue, loss of muscle mass, abdominal fat gain, and even symptoms of depression. Basically, it destroys the potential of your masculine life. For women, hormonal imbalance can affect the menstrual cycle, bone density, and body fat distribution. A study from the University of Texas showed that men who included squats in their routine 3 times a week presented an increase of up to 17% in testosterone levels after 12 weeks, compared to the group that performed only isolated exercises. Benefit 7. Improved blood circulation. Daily squats are like a natural pump for your cardiovascular system. When you repeatedly go down and up, your leg muscles, which are among the largest in the body, compress the blood vessels and then release them, creating a pumping effect that propels blood back to the heart. With regular practice, the benefits accumulate. Your blood vessels become more elastic and responsive, improving blood flow to the entire body, including the brain. Blood pressure tends to stabilize, and the heart works more efficiently, pumping more blood with less effort. In the legs, specifically, improved circulation prevents conditions such as varicose veins, edema, and feelings of heaviness or tiredness at the end of the day. If you spend a lot of time sitting, squats are particularly valuable to counteract the negative effects of sedentary behavior on leg circulation. Poor circulation, something common and that most sedentary people don't pay attention to, can lead to serious problems. Stagnant blood in the legs increases the risk of deep vein thrombosis, a potentially fatal condition. Frequently cold extremities, numbness in hands and feet, and slow healing are other signs of compromised circulation that squats help to prevent. In fact, patients recovering from circulatory problems are frequently advised by doctors to perform adapted versions of squats as part of rehabilitation. Such is the effectiveness of this exercise in stimulating blood flow. Benefit 6. Improves joint health. There is a persistent myth that squats harm the knees. The truth is exactly the opposite. When executed correctly, squats are one of the best allies for long-term joint health. The squatting movement, when performed with proper technique, strengthens the entire support structure around the joints, muscles, tendons, and ligaments. This creates a kind of natural armor that protects your joints during everyday activities. Each time you go down and up, you're promoting the flow of synovial fluid, a natural lubricating substance, inside the joint capsules, especially in the knees and hips. This synovial fluid is like oil for the engine of your joints. It reduces friction between cartilages and provides essential nutrients to maintain healthy cartilage. Without regular movement, this fluid doesn't circulate properly, leading to drying and premature deterioration of joint surfaces. A study published in the Journal of Strength and Conditioning Research followed regular squat practitioners for 2 years and discovered that they showed up to 20% less incidence of chronic knee pain compared to non-practitioners of the same age group. Another surprising fact: Olympic weightlifting athletes who perform deep squats with extremely heavy loads frequently maintain healthy joints until advanced ages. In contrast, people who avoid exercises like squats for fear of wearing out the joints frequently end up with more fragile joints. Without adequate stimulus, cartilage receives fewer nutrients, ligaments lose elasticity, and the connective tissue around the joints weakens. This negative cycle often results in painful and unstable joints as early as middle age. Osteoarthritis, for example, a degenerative joint condition that affects millions of people, has as risk factors both excessive overload and lack of adequate movement. Benefit 5. Strengthening of bones. Did you know that your bones are living tissues that respond to mechanical stress just like your muscles? That's exactly what happens during squats. Each repetition creates a compression load on the bones of the legs, spine, and pelvis, sending biochemical signals that activate bone-forming cells, called osteoblasts. These osteoblasts work to increase bone mineral density, making your bones literally stronger and more resistant to fractures. It's as if each squat added a small layer of reinforcement to your bone structure. The effect is cumulative. After months of consistent practice, the difference in bone strength can be significant. This way, we can affirm that squats work as a form of bone savings, where each session is a deposit for your future skeletal health. This adaptation is particularly crucial as we age. Around 40 to 50 years old, we naturally begin to lose bone mass. For women, this loss accelerates drastically after menopause due to the decrease in estrogen, a hormone that helps maintain bone density. A study published in the Journal of Bone and Mineral Research demonstrated that adults who regularly performed strength training had significantly greater bone density than their sedentary peers, with differences of up to 8% in critical regions, such as the lumbar, spine, and femur. In contrast, inactivity leads to accelerated loss of bone mass. Sedentary people have a much higher risk of developing osteopenia and eventually osteoporosis, a condition where bones become so fragile they can fracture with minimal effort. A simple fall that would result in just a bruise for someone with strong bones can cause debilitating fractures in people with advanced osteoporosis. Benefit 4. High caloric expenditure and cardiovascular improvement. By simultaneously recruiting several of the largest muscle groups in the body, quadriceps, hamstrings, glutes, adductors, and core, squats cause an impressive caloric expenditure, even when performed without additional weight. When you complete a set of squats, your body enters a state of high energy demand. To fuel all these muscles working intensely, your cardiovascular system needs to provide oxygen and nutrients quickly, raising your heart rate to levels similar to those of traditionally aerobic exercises. What makes squats especially efficient for calorie burning is the EPOC effect, excess post-exercise oxygen consumption. After an intense session of squats, your metabolism remains elevated for hours, continuing to burn additional calories even when you're already at rest. Some studies suggest this effect can last up to 24 to 48 hours after exercise. In numerical terms, a person of approximately 154 pounds can burn about 80 to 150 calories with 50 squats, depending on the intensity and depth of the movement. This may not seem like much in isolation, but when added to the EPOC effect and performed consistently, day after day, the impact on body composition becomes significant. Remember that people with low cardiovascular conditioning frequently feel exhausted after simple activities such as climbing stairs or walking moderate distances. Constant fatigue, lack of energy, and slow recovery are signs of an underdeveloped cardiovascular system. Benefit 3. Increase in muscle mass. It may seem like a lie, but when you perform a complete squat, you're involving more than 200 muscles in a single movement. The main beneficiaries are the quadriceps, glutes, hamstrings, adductors, and core muscles. During each repetition, you create micro-lesions in the muscle fibers of these groups. These small ruptures are completely normal and healthy. In fact, they're essential for muscle growth. After the exercise, your body initiates a process of repairing these fibers, rebuilding them stronger and, over time, larger. This process is known as muscular hypertrophy. Many don't know, but the benefit of increasing muscle mass goes far beyond aesthetics. Each pound of muscle added to your body increases your basal metabolic rate. That is, the amount of calories you burn at rest. Studies show that each pound of muscle mass burns approximately 22 to 31 calories per day, even when you're doing absolutely nothing. Compare this with body fat, which burns only about 1 calorie per pound. An interesting fact: research demonstrates that people with higher percentages of muscle mass not only live longer, but also present lower incidence of chronic diseases, such as type 2 diabetes, cardiovascular diseases, and certain types of cancer. Benefit 2. Release of neurotransmitters that provide a feeling of happiness and well-being. Have you ever wondered why so many people say they feel better after a good exercise session? The science behind this phenomenon is fascinating. During the execution of squats, especially when performed with moderate to high intensity, your brain releases a cascade of neurotransmitters and hormones that directly affect your mood and mental state. Endorphins, often called happiness hormones, are released to help deal with the discomfort of exercise, creating that feeling of euphoria that many know as runner's high, but which also occurs in strength exercises like squatting. Besides endorphins, squats stimulate the production of serotonin, dopamine, and noradrenaline, neurotransmitters directly linked to pleasure, motivation, focus, and mood regulation. The release of these chemicals not only improves your state of mind immediately after exercise, but also has cumulative effects on mental health when squats are practiced regularly. Studies show that people who incorporate strength exercises into their routine present lower rates of anxiety and depression. In contrast, the lack of these neurochemical stimuli can contribute to imbalances that negatively affect mood. Many people who suffer from anxiety disorders, depression, or chronic stress present suboptimal levels of these essential neurotransmitters. Another less known benefit is the impact on sleep quality. Regular practice of squats helps regulate the circadian cycle, facilitating falling asleep and improving the quality of deep sleep. Considering that sleep problems affect more than 1/3 of the adult population and are associated with various health problems, this benefit is particularly valuable. Benefit 1. Improvement of mobility and flexibility. When we think about improving flexibility, we usually imagine static stretches. However, squats offer a dynamic and functional way to increase the range of motion in crucial joints, such as hips, knees, and ankles. When performing a complete squat, you take these joints through their entire natural range of motion. With regular practice, your body adapts, allowing you to go down deeper and with more control. This adaptation occurs not only in the muscles, which become more elastic, but also in the connective tissue, fascia, tendons, and ligaments, which gain greater capacity for stretching and retraction. From this, simple movements like tying your shoes, picking up objects from the floor, or getting in and out of the car become easier and more comfortable. The improvement in hip mobility is also particularly valuable for preventing lower back pain. Many spine problems originate from hip stiffness, which forces the spine to compensate during movements such as bending forward. Interestingly, cultures where people maintain the habit of squatting completely to rest, work, or during social activities, common in parts of Asia, Africa, and South America, present much lower rates of joint problems in the knees and hips in old age. But now that you know all the benefits, it's fundamental to understand how to execute the squat correctly to avoid possible injuries. Start by standing with feet apart at shoulder width, or slightly wider. The toes can be pointing slightly outward, but this varies according to your individual anatomy. When beginning the downward movement, imagine you're sitting in an invisible chair. Start by pushing the hips back, as if you were going to touch a wall behind you with your buttocks. This initial movement is crucial. Many people make the mistake of starting by bending the knees first, which puts excessive pressure on the joint. As you descend, keep the weight distributed between the heel and the middle of the foot. Never let the heels leave the floor. Your knees should follow the same direction as your toes, without collapsing inward. The ideal depth of the squat depends on your current mobility. For beginners, going down until the thighs are parallel to the ground is a good goal, but don't force beyond what is comfortable for you at the moment. On the way up, push through the heels, actively contracting the glutes to extend the hips. Keep the spine in a neutral position throughout the movement, neither excessively arched nor rounded. In squatting, there are 5 common errors that you need to avoid. Number 1, allowing the knees to collapse inward. This puts excessive stress on the knee ligaments and can lead to injuries in the long term. 2. Raising the heels from the floor. This shifts the weight forward, overloading the knees and reducing glute engagement. 3. Rounding the spine, especially in the lower back. Keep the chest lifted and the spine in a neutral position. 4. Looking down. This tends to pull the entire posture forward. Keep your gaze fixed on a point in front of you, slightly above the horizontal line. 5. Not respecting current mobility limits. Forcing beyond the natural range can compromise technique and increase the risk of injuries. Remember that breathing is also important. Inhale during the descent and exhale, forcing the air during the ascent, especially in the most difficult part of the movement. This helps stabilize your core and generate more strength. If you liked this and also want to discover a simple exercise that only Asians do and is capable of healing years of negligence with one's own body, we have a video appearing right now on the screen. Don't miss it. Thank you for watching until here, and may God bless you, my friend.